Hello, this is Dr. Do again. This video is still on alphabetic list problems, still on letter S. Today I'm going to talk about the sleeping disorder. I had a previous video talk about the insomnia, but I think sleeping disorder is far beyond that just insomnia. Could be isolated sleeping disorder, either insomnia or hypersomnia, which means sleeping too much, or could be just obstructive apnea, or could be associated with systemic diseases. So let me just bring up an emergency situation, whether there's any emergency situation associated with this sleeping disorder. There's some conditions may, I think, consider as this part of this emergency, particularly in the young children, toddler or infant, or less than 2 years old. If your child usually loud, happy, and cry, but suddenly becomes lethargic, falling asleep with fever at the corner or without talking, without that loudness. So that's probably, I think children do not hide their disease. So this child stay at the corner with the fever and feel lethargic or sleepy compared to the other child, fever, crying louder. Actually, the first one, stay at the corner, quiet, falling asleep, probably is more dangerous or emergency compared to the second one, crying loud. Because that child, the first one I mentioned, probably just severely ill, without strength to cry, falling asleep. So if that's the case, bring to the emergency. Do not hesitate. The sooner the better. Just make sure everything's okay. Or the other is elderly or advanced age people. You cannot tell whether it's out of the mental status or delirium or stupor or sleeping. Just feel like not that person as usual, him or herself, himself or herself. If that's the case, I think it's also an emergency to get it checked and make sure there's nothing seriously going on. From systemic disease might be taken as sleeping. So this actually is not really sleeping disorder, but it could be taken as sleeping. So associated with this kind of systemic emergency situation. So in terms of the sleeping disorder, insomnia is one of the most common one. Could be caused by many factors, or there's some hypersomnia is also maybe I think a lot of time associated with other conditions. For example, severely stressed or depressed, or hypothyroidism, feel sluggish, sleepy all the time. So that's the case, particularly for young female, overweight and sensitive to the cold, and feel sleepy all the time. Get it checked, talk to your physician. Probably there's some hidden endocrine problems, for example, the hypothyroidism I just mentioned, or could be something else. And for this obstructive sleeping apnea, I think it's quite common. It could occur in young people, but the majority occur in the older or middle or advanced or later adulthood, particularly for this with overweight or obese. So if that's the case, usually associated with the snoring loud. For those snoring, could be the structural problem, or could be the sleeping position, or could be the overweight, or the tongue just draping to the back, to the posterior. So for those people, what kind of symptoms? Usually they feel sleepy during daytime, even though you think their sleeping hours is not like a lot of people are sleeping 3 to 4 hours a night, but they probably sleeping more than that, but still feel without any strong physical activities or a lot of vigorous physical activities, or without any extra stress, just feel sleepy all the time. They probably, particularly for this, have overweight or obese people, probably have this obstructive sleeping apnea. I think it's checked with your physician if you're middle or advanced age and overweight. I feel without energy all the time. during daytime, and even though you're sleeping more than normal hours, I think that maybe have this accompanied sleep apnea, obstructive apnea. So if that's the case, get it checked and get it treated, or some measures like the positive airway to keep the airway open, to improve the life quality. And in terms of the insomnia, I think I mentioned before, the major cause of insomnia is, of course, we know the stress, the daily activity, or during daytime you use your brain too much, which you carry in the exam or project, or really under stress of some causes. That's one of the most common cause, or some other physical uncomfort. Dehydration is the one. You do not know it. You just somehow you just couldn't sleep, toss and turn, and there's no probably severe distress or anything, but just couldn't get sleep. If that's the case, I think there's some simple regimen, just a sip of water, or half cup of water, see whether it can improve your sleeping. Of course, this is just for those really not falling into the category of diagnosis of insomnia. Just once in a while, occasionally couldn't fall asleep. Then if that's the case, you try this, see whether it works. If the difficulty falling asleep lasts a long time, seek your medical attention. I think you need medication to help you to fall asleep. I think sleeping is it's so critical for many of us. Of course, there's some people just have that energy. 3 to 4 hours can cover the daily activity, but majority of us need more. So a quality of good sleeping really build up your energy during for the next day. So it's critical. And there's some other systemic diseases might affect sleeping. First of all, the respiratory diseases, upper respiratory tract infection, we know it, nasal congestion, with or without fever, just coughing. Those are the common causes of difficulty falling asleep. It's not insomnia, but it's associated with sleeping. So if that's the case, get medication, treat congestion or coughing during nighttime to make sure you can sleep. And for the infant, for children, the nasal congestion, probably not using medication, or keep the child sitting position in the either any kind of chair or whatever you have. Let them sit and sleep with moistured air, warm air, warm moisture air probably is better than cold. Either way, just keep the air moisture next to the child and sitting, and to make sure, and also bring down the temperature, use medications to make sure the child can sleep, so that you can catch up sleep also. I understand those young parents, that's a lot of it happens quite frequently to everybody. So this is about very I think very broad, superficial, but it's just I hope that serve as a reminder for those who couldn't sleep well. Find the reason and to see whether there's anything you can do to help. So I'm going to stop here today, and thank you for watching. I will see you next time.